Hi there. I think we'll start because you haven't really come to listen to me, you've come to listen to others. But I would like to welcome each of you here. I'm Alan Winter, President and CEO of Genome BC. And welcome to the 5th annual Don Ricks Distinguished Keynote Address. So this evening we have a very exciting speaker who will introduce to you in just a few moments. But I see a number of new faces in the crowd, and I thought I'd give you a quick overview on Genome BC. So as you may know, Genome BC is a not-for-profit organization that's really a catalyst for a successful life science sector in BC, supporting genomics-related research from large-scale science through to translation, with the goal of linking excellent science with users such as clinicians or industry leaders alike, so that we can create innovative jobs in this province. Now, genomics, as you know, is defined in all sorts of different ways. I like to think of it as molecular biology, or understanding biology at a molecular level. So if you think about the genome and DNA, you also think about every living organism that we have on the planet, and so our research scope spans not just human health, but also forestry, fisheries, agriculture, environment, bioenergy, and mining even, sectors of significance to BC's economy and its citizens. And this is made possible largely due to the continued support of the BC government, the federal government, and over 300 private and public sector co-funders. In addition to research, Genome BC is committed to public outreach, educational leadership, and creating dialogue to foster understanding and appreciation of the genomic science and technology in BC. So that's a little bit about us and what we do, and this is why, to some extent, is a context for why we support events like this. This is important for us. So moving on to this schedule, after the keynote address, our Chief Scientific Officer, Dr. Brad Popovich, will moderate a 20-minute Q&A session. So if you have questions, there will be time to ask. We'll also be taking questions from Twitter, so please use the hashtag DRDK14. Following this, please join us for a reception in the Georgia Ballroom next door, where we hope discussions will continue. And from previous events, that's where there's a lot of good chat. Tonight, we recognize Dr. Don Ricks, one of the co-founders of Genome BC and our chair for 4 formative years. Now, Don was a physician and healer who saw the need of in his practice for better diagnostics, founded a system of clinical labs which today is known as Life Labs across Canada. He was physician to Michael Smith, UBC's Nobel laureate, who convinced him that genomics was an important science for the future. To quote Haig Ferris, another of our board members, Don Ricks was a man of action, a man of vision, a man of compassion, and a great Canadian. He was a great entrepreneur, a committed angel investor, and a generous and effective donor to many causes. Don was quick to support young entrepreneurs and educational initiatives. Where others saw problems, Don saw opportunity. His cheerful, constructive contribution to every organization he supported was an inspiration to everyone. His legacy of commitment will influence our community for generations, end of quote. So he passed away in 2009, and Genome BC decided that one way we could recognize Don Ricks and his legacy was to establish this annual keynote address in a way to continue inspiring our community. Last year's keynote address was delivered by Dr. Eric Topol, as you may remember, for those of you here, who has first-hand knowledge of the application of genomics in the pursuit of personalized or precision medicine, as Dame Sally likes to call it. Our keynote this evening, which brings us an international perspective on public health, is a topic of interest and applicable to everyone. At this time, I'd like to ask Dr. David Dolphin. You may remember David as the Genome BC board chair after Don Ricks. But David has a very interesting business card, and if you talk to him afterwards, he may actually give you one. But David, it'd be great if you could come and introduce Dame Sally Davies.
I'm actually selling them now. Alan, it's a real pleasure to be here this evening. And it's a special honor for me to introduce this evening's 5th Don Ricks Distinguished Keynote Address speaker, Dame Sally Davies. In the January of 2009, Sally was awarded a Dame Commander of the Order of the British Empire for services to medicine. In 2013, she was noted to be by the BBC, amongst the top 10 most powerful women in the United Kingdom. And in addition to all of that, she's an emeritus professor at Imperial College, which is one of the world's top universities. So Dame Sally is the first woman to hold the post of Chief Medical Officer of England and Chief Medical Advisor to the United Kingdom. It took the British government 155 years to appoint a woman to the post, and Sally is the first bureaucrat in 150 years to have been elected a Fellow of the Royal Society. Now, it's not that easy to become elected a Fellow of the Royal Society, and it's not because Sally was simply a superb bureaucrat, but let me, if I may, read the citation for the Fellowship of the Royal Society. This is the Royal Society in London, you know, the one that Christopher Wren, Einstein, and every other famous scientist has been a fellow of. So the citation reads, Sally Davies has made an outstanding contribution to science through her exceptional leadership in health research. Sally has worked tirelessly and successfully to put scientific evidence at the heart of government decisions that affect public health. Dame Sally is also the Chief Scientific Advisor for the Department of Health and independent advisor to the government on medical matters with particular responsibility regarding public health, and is the head of the Medical Civil Service. Just before I ask Sally to come up and give her talk, I'd like to tell you a genomics story. And it's okay, Alan, it's clean. So when Crick and Watson were awarded the Nobel Prize, there was a scientist at Columbia University by the name of Edwin Chargaff, who was quite upset that he was not included. Now, Edwin had shown that there's a complementarity between the bases in DNA, and while he showed that for a large number of species, he didn't understand what it meant. However, when the Nobel Prize was announced, he got sufficiently upset that he said, surely it must be the sunset of science when pygmies such as these cast such long shadows. And you can see he was upset. But in typical fashion, he got it wrong. And as you'll hear tonight, as you know from the work that's going on here in BC, Genome BC and around the world, it wasn't the sunset of science, it was the sunrise. Sally, please.
Follow that. So, thank you. First, I'd like to thank Genome BC and Alan and his colleagues for inviting me. I can only say that I hope I'd do it well enough to honour Don Ricks as we should. So I'm going to take you on a journey through public health. I am the head of the public health profession in England as well as the UK government's medical advisor, but I'm actually a haematologist, a blood doctor. So I've become expert at public health, but I didn't know it at the beginning. And I had to start by finding out what public health is. We all know, but I like to actually have things defined. And while it won't mean much to you, I have just been unpacking well-being because it seems to have groupthink in Britain. And in a report I published about 3-4 weeks ago, I unpacked that we don't have a definition. So all of the work that's quoted about well-being in mental health doesn't have validity, and therefore the government should no longer invest in that area of mental health. but that's another part of public health. So I find this definition back from 1920 useful: the science and art of preventing disease, prolonging life and promoting health through the organised efforts of society. Winslow was the first chair of public health at Yale University, and I think what's good about this is it draws on the intersectoral issues that come in public health. Others, the Institute of Medicine, use a definition much more around what we as society do collectively to assure the conditions in which people can be healthy. But I think this works for what I'm talking about, because I would argue, thank you, that public health is actually at the centre of every person's life across the globe and here in this room. And it covers all areas of public and actually private activity. And it embraces that nature-nurture debate. And of course, as we're thinking about genomics, when I started in genomics, it was about the DNA pattern. And more, it's about epigenetics and how we change that DNA and how what our mothers and grandmothers did, smoking, eating, not eating, impact on that. And more recently, the work in mice suggesting that if a female mouse had had sex with another mouse before the one that sired their children, there was some imprinting through that, to which my husband and I had a very nice debate about. That's why Princess Diana had to be proven to be a virgin. The royal family understood about epigenetics before we knew about it. So genomics, nature and nurture matter. So what influences public health? And if you are of the profession, you want to talk about the things we do now. But actually here, what I'm showing you is death rates of whooping cough. And you can see, starting in 1850, that it went up a bit. But then in the late 1800s, it started to drop. And I've shown you where the causal organism was identified and then where vaccination, immunization came in. And actually, we were making big inroads well before then. And the inroads we were making were those in this, what I've shown as the waves of public health. They were the public works. And that was public health in its original manifestation: sanitation, plumbing, better housing, better air. And what I'm showing you here is some work that I did with colleagues, trying, as I started, to think through what is public health and where should public health go, because I like to bring academic rigor and thought and innovation into what we do. And clearly it started with public works, but then I think you get the progress of science, the understanding of infection, what caused it, the coming in of immunizations, clinical epidemiology coming in, that we began to understand risk factors, the Framingham study on heart disease showing what were big risk factors coming there. Social epidemiology, looking at health inequalities and how those impact on health and poverty, things like that. But actually, no wave supersedes the previous waves. Public health, if it's to be successful, has to be that wave and the previous ones. And I'm going to show you why I think that's particularly important. But I think we're also moving into a new wave that has to build on the previous ones, that we need a culture for health, we need social engagement, and that is about making public health everyone's business, because private health is a part of public health. And that takes you into community interventions, it takes you into interventions for health at work. Some of you will know the study in Finland, where they really put a whole